Hello everyone and welcome back. So we have started the unit endocrinology from first aid. We are going to discuss the thyroid hormones today. So thyroid produces triiodothyronine and thyroxine. These are iodine containing hormones that controls the body's metabolic rate. Thyroid release triiodothyronine and thyroxine. Thyroxine is T4. These hormones control metabolic procedures in the body. Now, what is the source of these thyroid hormones? So, the follicles of thyroid, that is 5-deiodinase, converts T4, the major thyroid product of T3, to peripheral tissue 543. Okay, what happens? The 5-deiodinase converts T4 to its active form, that is T3. The peripheral conversion is inhibited by glucocorticoids, beta blockers, propylthiouracil. Reverse T3 is metabolic and inactive byproduct of the peripheral conversion of T4, and its production is increased by growth hormone and glucocorticoids. Here it is mentioned then what are the products that decrease the secretion of or the conversion of T4 to 3. So these are some drugs and hormones. The drugs are propylthiouracil, beta blockers, and glucocorticoids. These are the substances that inhibit the conversion of T4 to its active form T3. Okay, so this is the concept. Now the T3 is the active form is T3. The RT3 is the reverse T3, which is metabolic inactive byproduct of the peripheral conversion, and which is due to the action of these drugs, that is propylthiouracil, glucocorticoids, and beta blockers. Okay, now the functions of thyroid peroxidase include oxidation, organification of iodine, and coupling of monoiodotyrosine and diiodotyrosine inhibited by propylthiouracil and methimazole. Again, that point is mentioned. Okay, diiodotyrosine combinedly form T4 and diiodotyrosine plus monoiodotyrosine form T3. Okay, let's okay. So in this line it is simply mentioned that thyroid hormones are two, that is T3 and T4, and this does the metabolism in the body. Now how it is produces? It is produced by the 5-deiodinase convert 5-deiodinase is present in the follicles of thyroid, and this convert T4 to T3. Okay, now what are the substances that inhibit this? So these are propylthiouracil, glucocorticoids, and methimazole, and also the beta blockers. These are the substances that inhibits this normal synthesis. The active form is T3, and the reverse T3 is the inactive form, metabolically the inactive byproduct of the T4. Okay, the next point that is mentioned is that thyroid peroxidase. This is the function of thyroid include. This is the thyroid peroxidase is present in the thyroid follicles, and its function is that it's do the oxidation of T3 to T4, also the organification of iodine, and also the coupling. The coupling of what? The DIT plus DIT. DIT is diiono tyrosine. So when these two combine, it form T4. Also, it do the coupling of DIT plus MIT. So it is T3. So simple concept of this para is this. Okay, now what is the function of T4? So we will remember this by 7 B's. The function of thyroid can be remembered by 7 B's. It does the brain maturation, it does the bone growth, it does the beta adrenergic effects, that is increase beta 1 receptors in heart, and it increase the CO, heart rate, and systolic function, and the contractility. Beta blockers alleviate adrenergic symptoms in thyrotoxicosis. Also, it do the basal metabolic rate, that is increase sodium, potassium ATPase, increase O2 consumption, respiratory rate, and body temperature. It also increase the blood sugar, that is increase glycogenolysis and gluconeogenesis. It also break down the lipids, that is lipolysis, and it also stimulates the surfactant synthesis in the babies. So we would remember it from 7 P's. What are these? Brain maturation. First of all, the thyroid hormones do brain maturation. Then the bone growth, that is synergism with growth hormone and IGF-1. As we have discussed that growth hormone do the increase the muscles and bone mass by the release of IGF factor 1. So this bone growth is stimulated by the thyroid hormones. Okay, is the thyroid releasing hormone increase the growth hormone, so here it helps in the bone growth. Also the beta adrenergic effects, that is this thyroid increase the beta receptors in heart, so this increases the cardiac output. The beta receptors, beta adrenergic, these are the beta adrenergic. TSHR or thyroid hormones are natural beta adrenergics, so this increase the beta 1 receptors in heart. As a result, cardiac output increase, heart rate increase, systolic valve function increase, contractility increase, and beta blockers alleviate adrenergic symptoms in thyrotoxicosis. Okay, this was the third function. Then basal metabolic rate is also increased via the sodium and potassium ATPase pumps. The thyroid stimulating hormone increase sodium and potassium ATPase pump. It increased the O2 exhaustion. As a result, respiratory rate is increased and body temperature is regulated. Also, it regulates the blood sugar by increasing glycogenolysis, that is the breakdown of glucose, and gluconeogenesis, the storage of glucose. It also breaks down lipids, that is increased lipolysis, and it also stimulates the surfactant synthesis in babies. Okay, brain maturation, bone growth, beta adrenergic effects, then basal metabolic rate, then blood sugar, then the breakdown of lipids, and then the release of surfactants in the baby. These are the functions. Now, the regulation of the thyroid stimulating hormone. So, it is done by thyrotropin releasing hormone, which is the hormone of hypothalamus anterior pituitary gland. It starts the release of thyroid stimulating hormones. As a result, it acts on the follicular cells, and thyroid stimulating immunoglobulin may negative follicular cells in the Graves' disease. Okay, now what is negative feedback? Primarily by free T3 and T4. Anterior pituitary decrease the sensitivity to thyroid releasing hormone, and as a result the hypothalamus increases the thyroid releasing hormone secretion. Whenever there is a T3 and T4 amount, the T3 and T4 amount um, uh, accurate in the body, so it started negative feedback mechanism. What is it? T3 and T4 goes to the anterior pituitary and tells it that we are enough, don't secrete more. So the anterior pituitary tells hypothalamus that the T3 and T4 is enough in the body, don't release more TRH, so the secretion of TRH decrease. As a result, anterior pituitary secretion of the TSH decrease, and as a result T3 and T4 decrease. So this is the negative feedback mechanism. Okay, now thyroxine binding globulin binds most T3 T4 in blood, and the bound T3 and T4 is present in inactive form in the blood. When the thyroxine binding globulin is increased in pregnancy, OCP use estrogen increased total binding globulins, and also it increased total T3 and T4. The total binding globulin decrease in steroid use and nephrotic syndrome. Okay, so it is mentioned here that the thyroxine binding globulin binds with T3 and T4, and these T3 and T4 lies in the inactive form in the blood. Now, in which conditions the TBG, thyroxine binding globulins, increase? So it is in pregnancy. In pregnancy it increased. Also in the oral contraceptive pills, these TBGs increased. So as a result, the total T3 and T4 increase. Okay, now in which cases the TBG is decreased? So it is decreased in steroid use and nephrotic syndrome. Whenever the patient is using steroids, or a patient is going through nephrotic syndrome, the total binding globulin proteins are decreased in the blood, so the T3 and T4 cannot bind to it. So most of the T3 and T4 are in active form, and it can lead to hyperthyroidism. T3 and T4 are the only lipophilic hormones with charged amino acids and require specific transporters to diffuse into the cell. You should remember this point. This is very important. The T3 and T4 are lipophilic hormones. Okay, and with charged amino acids. The amino acids that are present in it are charged amino acids having charges. Okay, so they require specific transporters to diffuse into the cell. They cannot diffuse into the cell alone. They need transporter to diffuse into the cell. Now this is hypothalamus. This is anterior pituitary. In anterior pituitary, these are the lobes of thyroid follicles. in the anterior pituitary, in front of it thyroid follicles are glands are present which secrete T3 and T4. Okay, so the hypothalamus increase TRH, thyroid releasing hormone. The anterior pituitary then release TSH, and the TSH goes to thyroid gland follicular cells and release T3 and T4. Okay, now this is the cycle for T3 and T4. This is T3, this is T4, and T3 is in the active form. It does the downstream thyroid function, and whenever this 5-deiodinase convert this T3 to T4, T4 to T3. But if the external factors like drugs of propylthiouracil or glucocorticoids are present, then this T4 is converted to the inactive form, that is reverse transcriptase 3.